Hello, everyone, and welcome back to the UCM Podcast. I'm your host today, Dr. Bill Davis from UCM Practice Growth Systems, where we help you grow your upper cervical practice. And on the podcast today is a friend of mine, great upper cervical practitioner in New Jersey. Welcome back to the podcast, Dr. Larry Arbeitman.
Always good to be here with you, Bill. Excited to have our conversation.
So Larry's been on the podcast several times over the years, and just have known him now a long time. I'm thinking maybe a decade
at least.
And so I would love, though, for you to just share a little bit about you, where you have come over the years. I know at this point, 5-doctor practice, well-run machine, and just helping lots of people in your community. So tell our audience about you, Larry.
Hello, audience. Hello, colleagues. It's an honor and a privilege to be here with all of you and just share a little piece of my journey with all of you to hopefully make your practices better and to help more people, because that's what this is all about. Who am I? I'm a humble servant. I show up every day to serve people. Statistically, where are we? This is, I think, our 23rd year in practice, 20 in my specific practice, upper cervical chiropractic in Monmouth in central New Jersey. Just love taking care of people still. I think we're just getting started. There's a lot of juice in this tank. There's a lot of great things coming up on the horizon. We've trained over 15 doctors through the years. Our clinic has done north of 300,000 visits. And we have a vision of serving over 1 million. So we're not even halfway there yet. We're getting there. And we just want to be a beacon, a place of hope and healing. And that's what I think all doctors want to do. And we do that in a very specific model called the Care First model. You got to care first. Really care, truly care. We'll talk more about that.
Yeah.
And I think one of the things I'm most proud of is just the maintenance portion of our practice. Our PVA has been north of 100 for years now. Once a patient starts with us, they stay with us, and I'm proud of that because that means they understand the principle. And it's all cash-based model, which I think is important for the service that we provide, to be able to be in fair exchange with people, be profitable. If we weren't profitable, we wouldn't be able to have 5 doctors and serve as many people. We'd just be trying to, survive to the next month. And if you're trying to survive, you're not thriving. So
Right. Love it. So let's get into this Care First methodology that we were talking about here before we started. And I just love this idea. And, obviously it's such a crucial portion of what you need to do in an upper cervical practice to really set yourself apart from anything else that's out there, because, so frequently there is a lack of caring when it comes to healthcare in our world. So, let's talk about that. What is a Care First approach really mean to you?
Well, I think the chiropractors probably need this information less than other healthcare professionals. But however, most people are tuning in because they want to improve their practice. They want to help more people. And I would say this is really where it starts. I mean, you've got to have marketing and you got to have strategies and you've got to have procedures. But who you are, who you're showing up as, is going to determine how all of that works. And the culture that you build is going to determine how well that works. And it's pervasive in the healthcare system right now that people don't do. The other practitioners out, not all, but this is a generalization, but if someone goes into a healthcare practice outside of our office, they're going to have a very different experience, and it's not always a good experience. Right. And we hear it time and time again from patients and staff. God, people, they just don't do it in other offices the way you guys do it. I just said you guys, so you realize where I'm from. the only difference between a practice that does $500,000 in revenue a year and $1 million in revenue a year is the one that does $1 million in revenue just cares twice as much. And the practice that does $2 million a year in revenue cares twice as much as $1 million. Because if you ask any doctor, Bill, hey, do you care about your patients? Of course they're going to say yes. And if you ask any staff, yes, I care about my patients. But could we care more? Could we be more self-aware? Could we practice with a higher level of consciousness around this concept of caring? And if we wanted to care more, if we wanted to show more love in practice, what would that look like? What are it's not a procedure. Because, oh my God, could you imagine like having a scripted way to say I love you to your wife? That would be very good for your relationship. But yet doctors are doing that every day in their practice. Your practice is waiting for the real you to show up. And in love and in relationship, it's authenticity. It's vulnerability. So we've known each other a really long time. This has been a journey for me. I was the procedure and systems guy. I was the guy teaching systems and procedures at seminars. And then I had, you know, where we're all growing and realizing things. And then I realized, you know, this goes back now like 15 years. I was like plateaued. My practice was plateaued. It was stuck. And I knew every script and procedure and communication skill. And then one day I was in a mastermind and we were meeting, you know, on Zoom every day, and the doctors from all around the country. And we met in Philadelphia to have an in-person mastermind finally for a weekend. And one of the doctors, one of the female doctors in my mastermind, when I saw her, I embraced her. I gave her a hug, like a professional hug. And she goes, "Wow, I never knew you had that in you based on our mastermind. Do you hug your patients like that?" I mean, this goes back now, you know, I'm way past it, but I'm still growing too.
Sure.
And everything changed. My practice went up 30% after that conversation, and it hasn't gone down since. Why? Because I showed up with an open heart. And so sometimes we're focusing on all the wrong things when we're trying to help more people.
Right.
Yeah.
Right. Yeah. And I love that. And it translates into really everything that you're doing, right? I mean, from, you know, you mentioned like scripting and that type of thing, but what you're going to say to someone, what you're going to say to a new patient, an existing patient, whatever it is, when you're talking with them, if you truly care about them, if you truly, you know, love them, you want the best for them, you have that intentionality behind you, that purpose that's driving you, that it changes what you're saying, how you're saying it, and how they receive it, right?
Yeah. Yeah. You know, here's an example. Bill, what's your wife's name?
Julie.
Julie. And how many children do you have?
3.
Okay. If we're friends, I should know the name of your wife and how many children you have. That's like the base acceptable bottom of a true friendship. We have a professional relationship,
Sure,
and we're friendly. But I didn't know your wife's name or kids' names. Now, I will never forget them because I'm just gifted with that. But in every single one of your charts, doctors, you should have the name of the patient's spouse if she's not a patient, and at least how many children. And if in next level, will be knowing their names. Why? Because if you truly cared about that person and you talked about their spouse, you wouldn't say, "Oh, and did you go away with your wife?" Or would you say, "Did you go away with Julie?" And that's one example. And that's because it comes second nature to us. Like if it's a day 2 report of findings and Bill comes back for his report of findings, my staff is going to say, "Hey, Bill, hey, Julie," even though Julie never stepped foot in the office. And Julie's going to be like, "Whoa, they know my name." Of course we know your name. You're our patient's wife. And that's not a tactic. That's human beings taking care of human beings. If Bill came into my house with Julie, we're going to greet him the same way we greet him in my chiropractic office. And something separated, like where doctors separated from patients and staff separated from doctors and staff, You've all been into healthcare offices where you walk in and they go, "Can I get your license and an insurance ID?" And they close the window in your face, or
Right.
they don't acknowledge you. Like, where did we become separate? We're all human beings going through this thing called life together. And as a chiropractor, we have this incredible opportunity to serve human beings every day. Why? So that they can get back to doing their service to other human beings. Do you see how spiritual and powerful this is?
Absolutely.
I promise you, you will be paid handsomely on the back end as soon as you get your head straight and your heart open.
That's it. That's it.
And if the healthcare system in America had that one concept, everything would change. And who wins by this? Everybody. The practices grow, the patients get better care, and the doctors get better results for their patients.
Yep.
And the staff loves working there.
Right. That's it. And so it benefits everyone when you show up with, like you said, with your heart open, with caring for people and genuinely wanting to see people win in life, right? I mean, you want them to thrive. You want them to, enjoy their relationship with their spouse, with their kids, be great in their work, right? Like when you have that kind of heart behind you and people see it, right? They notice, they understand that, hey, this doctor actually cares about me, right? Like, cause that's the key. Like it can't be enough that you have it in your own mind that you care for them. They have to see it, right? They have to see like, this person actually cares for me. And that changes everything when it comes to referrals, when it comes to retention, when it comes to, how they talk about the practice, even how they respond to care will be impacted.
100%.
Right?
Your results will go way up when people feel cared for. I mean, the adjustment's powerful. We have to be technically sound, but you get two doctors doing the same service and one really cares and the patient's physiology feels it versus the one that's like a mechanical robot. Come on, you can't even compare it. And this is where like there's been chiropractic practices in our history that they may not have this like incredible sophisticated technique like many of us do, but they've got incredible practices with incredible results, maybe doing something a little more simpler. So everything is hinging on this caring. And you think about if you come into your office and you look at your schedule and you see that you have a new patient and 3 reported findings, you get yourself already like, I got a new patient, I got 3 reported findings. But what about like your 30, 40, 50, 60, 100 other visits? Like, why don't you get as excited for those? Those are the ones that build your practice,
right?
Not the day 1 and day 2 that may start, may not start. If they start, they may not finish. Like those people that are already like, yes, I buy in. I want you to serve me. I want you to care for me. You don't take them for granted the same way you wouldn't take your wife or kids for granted. That's how we have to see all those daily visits. If you want more referrals, you just need to care more. The only reason you're not getting referrals is because why would they share with you if they don't feel that from you? So those are ways to care more. It's interesting because I was just asked to speak at a hospital here in New Jersey on concussions in the cervical spine. I'm going to get to do that in April. Cool. And this practice, it's an amazing neuroscience center that treats TBI. And when the patient plateaus, they send them to us. And we've gotten, great results naturally, of course. So I get on the phone with one of the clinic directors and I said, why do you wait? Why do you wait till they're stuck or plateaued to send them down? Like I understand you have PT and OT and visual therapy and all the things under your roof, but like no one's taking care of the cervical spine. Just send them down. Like, let's do it all together. And she said, well, your office is 40 minutes away. And I heard you don't take insurance. And I said, whoa. Time out. With all due respect, Dr. So-and-so, we must be careful that we're not projecting our own stuff onto our patients. Because my practice for the last 20 years, the majority of people drive over 40 minutes and 100% have paid out of pocket. And these people that we're mutually caring for are at the end of their rope. And you can't project what they would do or not do. You just have to give them the life preserver, and then it's up to them whether or not they put it on.
Right.
And so that's what I mean by caring more. And we care more by taking ourselves out of the equation, our ego out of the equation, I need this person to start. I really hope they start. I really hope they accept what I say. Should I tailor my message so that I'm accepted? Are they going to appreciate and approve there is no Dr. Arbeitman when I'm in front of a patient. He does not exist. My needs, my wants, my desires, my ego, none of it is there. It's pure love and light. That's why I felt uncomfortable when you asked me my credentials in the beginning. And I started by thanking everybody and telling everybody I'm a humble servant, because it doesn't feel good anymore, because it's my ego speaking.
Yeah. And
we are not our egos.
No,
we are not our egos. And if you want to grow your practice, you leave your ego in your car when you enter, and you teach your team to do it too.
Yeah. And that's it. I mean, humility is required for success, to truly be successful in life, in every area of life. And it's something that, if you're humble and you know it, no, you're not, right? So you gotta, if you have to consistently humble yourselves and not puff yourself up, right? Because again, patients will pick up on that too. If they think that that this practice is all about you and your ego and your, whatever, they will recognize that as well. So, this is when you're talking about caring, sometimes doctors, because we'll talk, obviously we talk with a lot of doctors and a lot of doctors that want to grow their practices. And, we'll talk about the importance of mindset and purpose and intentionality and these types of concepts that really are all tied in with caring. And sometimes doctors will be like, well, yeah, I've heard all that.
I get that.
Right?
I got it.
I've heard all that. Yeah. I mean, I've heard all that. And it's almost like it's too simple, or, it's like, but it's what separates the doctor that's struggling in practice versus the one that isn't. So
it's everything.
Can you speak to that?
It's everything. Because I could give you all the systems and procedures that I do, and you're still going to produce the results that you're currently producing until you crack your heart open and grow. It's you. And when a doctor comes to me, and I have them call me often, and they go, I need help in my practice, and they're asking me for advice, I tell them, go fix your home. And when they go, I'm having a problem at home, I go fix your business. And so the doctor that says I got it, that tells me they don't got it. Because the people that I converse with on a regular basis that are really high performers, they never say they got it.
Right.
Ever. I never hear that. So yes, this could be, is this esoteric? Like, all right, now we got the esoteric stuff out of the way. Give me the meat and the potatoes. I think you need both. I mean, I think it's not good enough to just care and have no strategy or poor procedures or sloppiness in your office. Like, no one's more buttoned up than us. But, all the procedures and marketing and strategy it's like, you ever walk into like a brand new house and it smells really good and you got fresh floors and a fresh coat of paint, but like no one's living there yet. There's no furniture. There's no art on the wall. There's no toys on the floor. There's no pears and apples on the counter. That's what makes that home feel yummy. And if your practice isn't where it needs to be, it's just not warm and fuzzy and yummy yet. And if it is, make it yummier and fuzzier and warmer and more loving and more caring. We all have it in us.
Yes. Well, and I wanted to say too, even systems, the whole point of having systems in your practice is driven from caring.
Yeah.
Right. It
Yes.
that's why you develop systems, is because you care about the results, right? You care that your patients are going to get consistent results. You care that your team is going to feel empowered, right? Like that. It's all driven by caring when it comes to, like, because that's why it's like, oh well, yeah, I'm going to focus on the nuts and the bolts. Yeah, but why? Because you care about the results, right? You care about growing your practice so you can help more people in your community. It's all driven by the same thing.
Yeah. Yeah. I mean, yes, yeah, that's a great point. Systems are about caring because if you have to care enough to actually implement the system.
Right.
If you didn't care, you're just like, I'll do it this way with this patient and this way with this patient, this way with this patient. And then that's massive confusion. What the systems do, no one in my office has any question on how we do this or how we do that, X, Y, every procedure, everybody knows what they're doing. And what that allows us to do is it frees us up to care more about the patient because all that other stuff is being handled. You're not constantly being inundated with what should I do with this patient? What should I do with that patient? You're not putting out fires all day because if you're putting out fires, you can't care. So the systems, save yourself time, energy, money, and stress, right? That's what it stands for. It frees you up to be who you want to be in practice.
Right.
As a humble servant.
And
we've got to get these concepts throughout healthcare. The chiropractors are the best at this because we are the most loving. I think registered nurses are probably pretty close too, but we are one of the most loving professions, and we've had to do it better because we just had to do it better because of the brand and where we were in the society and culture. But I will tell you that there's never been a better time to be a chiropractor. Never been a better time. The public is more ready for our system of healthcare, our system of health and healing. There's more distrust than ever before in some of the more conventional models. Yep. And it's up to us to just bring it to the public. And you're going to do that. You're going to lead with love, and you're going to communicate with that intent. And you've got to be sharing with everyone. This is a grassroots effort, right? We don't have the big industries propping us up, pushing us forward. We're not owned by any industry. We're not anyone's puppet. The reason we exist as a profession is because of our hearts and our results and our patience. Yep. So you enlist your patience in helping the mission of getting this to other people. If Mary has been served and is so happy with your practice, why isn't she filling your practice? Everybody can refer 100 people. And the reason I know that, because almost every wedding I've been to has had 200 people, 100 for the groom and 100 for the bride. Right. Everybody knows 100. You should have no problem getting internal referrals.
I love that.
But again, here comes the ego, right? Here's the self-talk, Bill. Well, They're going to think I'm asking for new patients. What if they say no? What if they don't have anybody? What should I say? How do I say it? No, that's all about you. That's your chatter. You're not really caring about them and the people they love, their Julie, their 3 kids. You care more about being accepted by them and how will they perceive you. But if you're really a humble servant, let's say you're a lifeguard and there's 1,000 people drowning, and you happen to have 1,000 life jackets, and you pull one person out and they're wearing a life jacket. Like, all you got to do is start throwing the life jackets in. The worst thing you can do is hold the life jackets.
That's it.
Now, that may put you out of business, Bill, because they're going to get so many internal referrals now, they're not going to need your services. No, but the truth is, we need Bill too, because we need both end.
Yeah.
We need both end. And
I'll tell you, we've been blessed to grow what we've been doing over the years too, to be able to help doctors both with, practice growth coaching, internal referrals, external marketing, digital marketing, all these different aspects of practice, because it all matters, right? Like you've got to be doing all these things together to really grow your practice and really make a bigger impact. And like you said, even that, like when doctors have a problem asking for referrals or asking about making referral statements, talking about these types of things, again, it's it has to not be about you, right? It has to be about others. And if you're focused on others, you're focused on who can we help in this community? How can we help more people? There's sick and suffering people that are out there that this person knows that I don't. And I want to give them an opportunity to help those people as well. That's what it's about. It's about others. It's not about you. It's, the success of your practice and the money you make and all those kinds of, that's all certificates of appreciation, right? It's connected to people appreciating what you're doing for them and they reward you with money. But that's not the driving force about what you should be doing. It's about caring for those people in the community who need your help.
Yeah.
And so, Larry, I wanted to talk about something else that's part of this, and it's something. Obviously, it's been something that I've talked about on this podcast for ever now. It feels like, but it's solo practice, right? There's still so many solo practices within upper cervical. And based on our surveys, we actually think it's getting better, right? 10 years ago, it was 80%. 80% were in solo practice. In our most recent survey, it was 65%, which is the lowest we've ever seen it. Great. So hopefully it's moving in that direction. But I'd love for you to speak to what does the doctor in solo practice and the connecting to this caring concept and how important it is to care. How would you encourage those doctors to take this step and move into a multi-doctor practice?
So we opened our practice in 2005. It was either the end of 2006 or early 2007 where I hired my first associate. And for me, what I realized was if I was really going to help a lot of people, I needed to move into an associate-driven model because I couldn't be there all the time for all the people and have a healthy life outside of my practice. And you look at the attorneys and the medical doctors got this right way before we did. They grouped up, they combined overheads. Now they've been swallowed up by venture capital, and you don't even really see sole proprietors in medicine, and now dentistry is even getting gobbled up. We need to combine forces because we have more strength. I just got off of my weekly doctors meeting where all the doctors on my team, we meet, we discuss cases. They bring ideas that I would have never thought of. They find inefficiencies. Sometimes doctors have a skill set that can help a patient better than another doctor, so that the patient can see that doctor. It allows your office to flow better because if I'm stuck, if I'm with a new patient and a patient needs to be seen, they're not waiting because now there's somebody else that can take care of them. So it's just going to help everybody's experience. And then from a business model, like who doesn't want freedom? Like who doesn't want to be able to go away and not cost you the cost of the vacation plus the cost of not being open? Like you don't have a business then. You don't have a business until you have a second doctor. You don't. You have a job. You have an expensive job, actually. You're like paying your employer sometimes.
Yeah. And again, it's driven by caring, right? Because if you're a solo doctor, you have capacity problems, right? Oh. It's just what it is, right? And it's, there was this movement within chiropractic for a long time, like develop a waiting list practice, right? And it's ridiculous, right? Yeah. When you have a waiting list practice, you have problems within your practice. Yeah. You don't, and if you truly care about those people who are waiting, then you would develop a multi-doctor practice, right? Like that's what it needs. You need to have more doctors to take care of these people within your community, and you can help more people get the help that they're looking for.
When people are ready to be seen by a chiropractor, they want to go now. They don't want to wait. They're going to go find another office.
That's right.
It's just the nature of what we do. Unless it's an internal referral and they're specific. but usually I need to get in now. Either there's an urgency or an emergency. And there's never a day that we can't get somebody in with our team and our staff. We had a new patient show up yesterday at 4:00. They were on our schedule for today, but they showed up yesterday at 4:00. And we were able to see them. For most offices, it would destroy your afternoon, or you'd send that person away and they may not ever come back again. So it just gives you flexibility and the ability to adapt and take care of people better. Yeah, it's totally about caring.
Yeah, absolutely.
Yeah, if you are a solo practitioner, that should be primo number one goal, is to get to that second doctor, or at least know at what point can I make that hire.
Right.
And we're always looking for talent. You asked me, you're looking for an associate, you have 5. I never stop interviewing. I interview doctors every month, every year, because do you think the New York Yankees stopped looking at shortstops just because Derek Jeter was there? No, They knew that one day Derek was either going to retire or get injured. They needed to be prepared, and so should you. So if you're a solo doctor, you should be preparing for what's that point, what's that metric, and let's start interviewing. And if you're a doctor like me that has an amazing team, you should always be looking, because you just never know when that next superstar is going to come along.
Yeah, and I'll tell you something else too. If you are in solo practice, and because I know that you've experienced this within your own practice, and you don't want to hire another doctor, you don't feel like you're equipped to do that. You don't want to grow the practice beyond yourself. Maybe you should go work for another doctor, right? Like that is another option, right? Some doctors are better associates than they are clinic directors. And that's another way you can have a multi-doctor practice that's going to be more sustainable and maybe be able to help more people too. Because I know,
and you may make more money.
You may actually be able to help more people that way than on your own. Yeah,
for 100%. Yeah. Don't worry. Hey, there's some months where I wish I worked for somebody else. I wish I had my associates deal some months.
Right. Yeah. So
we traded for anything.
Speak of that real quick, because I know that you've done some restructuring in the past few years, kind of what with your responsibilities and one of your, some of your associates' responsibilities and whatnot. Talk about that and what that transition has been like.
Yeah. So last year, for the first time in the 20 years of our practice, I installed mid-level management. So it was always Dr. Arbeitman as everything: the CEO, the head doctor, the CA trainer, the doctor trainer, the marketer, the everything. And I have some really exciting things coming up on the horizon, and people can kind of keep their ears out for that. But I couldn't work on the next stage, the next thing, and do all those other things. So I have a clinic director, Dr. Chisholm, in our office, and I have an office manager. Her name is Kara. She's been with us for 5 years, and they run the practice. I'm well aware of everything that's going on. I'm still running meetings, but I now have a layer between me and the other employees and patients. So if I need something done or something trained or something implemented or something removed, I go to them. They're my portal of entry. And so I think that's really important. That's something to work towards for some of the more seasoned and established practices that haven't set that up yet.
Yeah. And so now they've taken on, I'm assuming they've taken on the training of the CAs and the other doctors and whatnot as well.
Yes. Yeah. So Dr. Chisholm runs DC trainings on Fridays. Cool. I meet with him once a week instead of meeting with all I was training all the doctors, and some weeks individually. I was like, oh my God, like, when do I eat lunch? Not that I care about eating lunch, but the point is, it was like stretched so thin, and then it wasn't allowing me to move into the next expression of myself.
Right. Yeah, that's great. Larry, always appreciate having you on the podcast. Such a pleasure, and really appreciate you. Is there anything else you wanted to share with the audience before we wrap up for today?
Yeah, I just want chiropractors to be confident healthcare practitioners. Mm-hmm. What we do for people, especially upper cervical doctors, is literally a gift from God. I believe that we were all put here for a purpose to help other human beings. And I will tell you that brain stem, that is BJ and DD, they had it. They were talking about this stuff before it was cool to talk about it. Life force, spiritual energy filters into the body from above down and inside out, right through that brain stem. It is impossible to fully express your life, a human being's life, and that pressure on the medulla. God comes right through that foramen magnum. We are the only licensed healthcare practitioners that are trained to detect and correct interference, disturbances, biomechanical changes at this so very important place that connects men and women with their creator. And we're the ones that can deliver that service. And it'll never come in a pill. It'll never come at a hospital. It'll never come at an urgent care center. We are the only ones to do it. And when we realize, and when you realize how big that is for humanity, you will need 5 doctors.
That's
Not
right.
more.
That's right.
Go get them.
Awesome. Well, love this conversation, and make sure you keep caring, right? Care.
Caring, open your heart up, show up big, love
That's
on
it.
them, love on them, love on them. Thank you,
That's
Dr.
it.
Bill.
And as we always say, go team upper cervical.